record in 5, 4, 3, 2.
We're here in the lab with Dr. Stan Kikkert, a biology professor at Mesa Community College. Stan, we've known for years that bacterial events have besieged the medical industry. Hospital room operating devices have been identified as incubators for germs. But now we're learning that the dangers begin right in our own homes.
Well, absolutely. We have microbes that cover our skin. We have microbes that live in our upper respiratory tract. So we're constantly exuding microbes, and they're going to be present on anything that we're in contact with. And if we start to look at public places where there's shared equipment or shared facilities, then we could very easily be in contact with microbes that were once a part of someone else's body.
I see. Well, you know, Dr. Charles Gerben of the University of Arizona Environmental Microbiology Department was recently quoted as saying, "The remote control in a typical hotel or home is considered dirtier than the toilet, sink handles, door handles, and even the infamous bedspread." Do you agree with that?
Well, I haven't seen Dr. Gerber's data. However, many of those devices that you mentioned are often coated with metals, and those are generally antimicrobial in nature. Now, the bedspread, that's kind of an interesting one. I don't know. Probably you'd have to look at the materials, and some maybe are better or worse. But we look at things that we hold in our hands, things that have crevices, handsets, and things like that. I would expect that they would have a lot more microbial exposure than something like a sink handle that's made of metal. Absolutely.
Well, cold and flu germs form from sneeze droplets can stay on the surface for up to 48 hours. Is that not right?
Absolutely. They can stay on the surface. They can still be infectious. If they don't dry out, they could be viable for quite some time. In many cases, longer than 48 hours.
And they're resistant to just the standard cleansing wipes. Is that correct?
Well, you'd have to look at the particular bacteria and have to look at the actual treatment. Many chemical disinfectants are very effective at cleaning microbes, but when you have surfaces and with contours and textures, oftentimes those cleaning agents might not get there.
Well, what type of organisms are growing on our devices that we use regularly?
Well, I would say if we look at bacteria that live on our skin, we're looking at Staphylococcus species. Staph aureus is a common, can be potentially a human pathogen. There are other species of Staphylococcus. That would probably be a primary organism of concern, but you could also have viruses that cause warts and things. Those could also be contact related.
Interesting. Well, everyone in our home is using the phone or the TV remote. I noticed that you have a bunch of canisters there in front of you.
Yeah,
what does that represent?
Well, we did some studies. We were kind of curious to see, especially in the age of cell phones, there's a lot of people have their own phones, and a lot of cell phones are coated with glass and things, but most of us work somewhere where landlines are still being used, and so there are a lot of traditional landlines in place that get shared by people at the workplace, and if it's a medical related facility, there might be a cleaning procedure for those phones, but many places no one really thinks about cleaning those phones. And so we did some studies where we kind of looked at comparing different parts of handsets and looking at things with the mouth and comparing what we'd see with the mouth, bacteria that we could swab up and isolate compared to what we saw here where you put your ear. And we found with many of these that there was quite a lot of contamination. There was certainly, this one here was from a local market at the deli shop, and you could see the amount of bacteria on the handset in the mouth area is
That's quite substantial.
Quite extraordinary, absolutely. And then here on the ear side, not quite as much, but even still you can see lots of different bacteria. And as we talked about earlier, we look at the color and the shape of these colonies. We call that colony morphology. And by looking at the differences in colony morphology, you can get a sense of the differences, the different types of species that are present here in these environments.
So outside of the fact that one of these came from a local deli, as it were, even in our own homes, in our standard day-to-day usage, we are both encountering and creating bacteria of our own.
Absolutely, absolutely. We have millions of microorganisms living in our skin. And as I said earlier, we have them in our upper respiratory tract. Every time we sneeze or cough, we're spreading those organisms. And if we look at something like a television handset, you can tell, and that's something that we did some sampling on home devices here, and we saw lots of examples of microbial growth. So in the case of the handsets, we just looked at them in general, and just a great example here, lots and lots of different species. Once again as well, here's another plate that shows a lot of different microbes, not quite as many as the one on the left, but certainly these are not sterile devices by any stretch. These presumably were on the surface of someone's skin, were transferred over to the handset where they could then be picked up by someone else or through sampling or whatever and cultivated.
Well, GermBlock, we were aware of that, and we created an antimicrobial polyethylene sleeve. Would you agree that that might be an effective counter to the bacteria that is discovered on these devices?
Absolutely. The polyethylene sleeve is going to create a barrier by which microbes cannot pass through, and so anything that is present on the device the user will be protected from that by using the sleeve here. The coating, the antimicrobial coating, could also be useful as well, preventing transmission from the user skin actually onto the plastic, depending on the duration of the sleeve. If the device is shared amongst other people while the sleeve is there, that antimicrobial coating will certainly reduce the chance of contamination while that sleeve is in place.
Of course, we picked up our experience from hospital usage. This, for example, is a device that is used to operate the hospital bed in a patient room. It also has the nurse call signal on there, as well as the television channel changer and sound remote. We have found that the best usage of these involves changing these sleeves on a daily basis.
Absolutely, absolutely. Yeah, you would want to change this depending on the patient, the conditions, the people in the room. You would certainly want to change these on a regular basis. As you can tell, as we all know, people who are in the hospital have medical issues, and a lot of times we're taking multiple drugs in the hospital, especially antibiotics, and that actually cultivates for microbial resistance. And so when you have surfaces like this that are in a hospital room that could be shared by multiple patients, you could see the utility of this device right away.
Well, would you concur then that having a sleeve of this type on any device would provide a protection from that bacteria and those germs?
Absolutely. This polyurethane, this coating here, this sleeve will act as a barrier. So any microbes that are present on the device will not pass through this barrier, and any microbes that are present on the surface of the individual using this would also not be transmitted onto the device as well.
Well, I think it should also be pointed out that by having the sleeve on in that protective position, it does not inhibit in any way the functional use of the controls of the device, nor does it impede the sound from coming out of the speaker.
Yeah, and obviously that's going to be relevant. We certainly want these devices to be still usable.
Well, as we were discussing earlier, we also found that the one device that's found in virtually every home, often in almost every room, is a television remote control. And because there are such a large number of raised buttons and nooks and crannies and crevices, we feel, and certainly the studies have indicated, that this particular device is probably the filthiest device in the home environment.
This is going to be the one that gets the most contact. As you mentioned, there are many surfaces and crevices here where microbes could be very difficult to be cleaned, very difficult to clean these completely and sterilize them. And you probably will have, at some point, actually colonies maybe even living here, depending on if people are eating while they're watching television. They could be transferring nutrients for these bacteria as well.
Well, and as I recall from your previous studies, the origin of some of these bacteria is pretty creepy, isn't it?
Well, we live with microbes. They, in some ways, keep us healthy, but we've lived with them for hundreds of thousands of years. And so they live in all parts of our body and often friendly, but often the source of, of disease.
But we've also been able to discover that humans being humans, not everybody washes their hands after they've eaten.
Sorry,
or
Chuck.
after they've...
Start that question again, because he did the cough, and I want that clean.
Oh, okay.
Yeah, so don't worry. If he does that, just stop and start over, and that,
I don't know.
Yeah,
Sip
okay.
water?
Okay.
Let's see, what was my train?
Sorry, I can help you by saying you're talking about germs, but
Yeah, thanks.
You want me to get you some water?
Actually, could you?
Yeah, I have the bottle in the car I didn't open.
Oh, yeah.
Yeah.
Could I get back in here?